OSA, or obstructive sleep apnea, is both the most common and the most troubling sleep-related breathing disorder. OSA causes a person to stop breathing repeatedly during sleep. These nighttime pauses in breathing prevent restorative sleep and have far-reaching consequences for overall health and well-being. When most people are asleep, air flows freely through the upper airways into the lungs, giving a stable level of oxygen in the bloodstream. In individuals with OSA, the tongue and soft tissue in the airway relax during sleep. As the tongue and tissue partially obstruct the upper airway, it causes loud snoring. When the tongue and tissue totally obstruct the airway, it causes an apnea and breathing stops. The chest continues to move as the person tries to breathe, but the blockage prevents fresh air from reaching the lungs. The oxygen content in the blood goes down. An apnea may last anywhere from 10 to 60 seconds before the brain recognizes that there's a problem. The brain briefly arouses the body from sleep, just enough to open the airway. The person with OSA can be observed snorting, gasping, or choking for breath as the airway opens and air flows back into the lungs. After several breaths, the oxygen level in the blood is restored. The individual falls back into a deeper stage of sleep. The tongue and soft tissue relax again, and the airway becomes obstructed. Apneic episodes can happen hundreds of times in a single night. The individual is most often not aware of their frequent arousals from sleep. They wake up feeling exhausted and sleep-deprived, even though they spent adequate time in bed sleeping.